So let's talk about some of the things that you may or may not see on your nurse practitioner board exam. So the fundamentals of the eyes, we do know that cones are responsible for color, perception, 20/20 vision, sharp vision, and then rods help you detect light, shadows, and night vision. So if a patient presents with eye complaints, you're always going to assess their visual acuity first. So you would use the Snellen chart for that, and you would assess central vision and stand 20 feet back. And this tests the cranial nerve, which is the optic nerve number 2. Okay. And then you would also assess their visual fields confrontation, which assesses the peripheral vision test one eye at a time. And that also assesses the optic nerve, which is cranial nerve number 2. And then you're going to do the Ishihara color test, which assesses for color blindness, and it presents during childhood. And so they must be able to read and follow those instructions. Of course, normal vision scoring is 20/20 vision. The patient always comes first. So the first 20, that would be the patient. So a patient can see from 20 feet what a normal person can see from 20 feet. That's what 20/20 vision adds up to. So abnormal vision scoring, 20/200 is considered legally blind. A patient can only see from 20 feet what a normal person can see from 200 feet. So that's not good. 20/40, a patient can see from 20 feet what a normal person can see from 40 feet. And that's still kind of not good. So strabismus, which is horizontal or vertical misalignment of the eye. And the diagnostic test for that, you're going to do the cover-uncover test. It's considered a normal finding in infants and should correct on its own by 4 to 6 months of age. If it's unresolved or untreated, it can lead to permanent vision loss or abnormal vision. And so amblyopia is lazy eye and estropia is cross-eyed. And so on your fundoscopic exam, retinal veins, they're going to be larger and darker. Retinal arteries are going to be thinner and lighter. And so retina exam findings, sharp margins, yellow-orange in color, round oval in shape. You should always see a red reflex, always. If it's absent, that's abnormal. A white pupillary reflex is visualized during a fundoscopic exam or with flash photography. That can indicate a retinoblastoma or congenital cataracts, and then you want to refer them to the ophthalmologist. If a person who has hypertension, so Ed knows that nicked wires cause flames, okay? So number 1, Ed, papilledema, which is bilateral swollen optic discs with blurred edges, elevated intraocular pressures, emergency. You're going to refer to the ED immediately. Nick, which is number 2, AV nicking, arteries and veins cross, which cause a bulging. It's reversible with getting the blood pressure under control. Copper wire arteries, arterioles appear red copper due to thickening, which is also reversible with blood pressure control. Flame hemorrhages, diffuse brushstroke hemorrhages on the retinal nerve fiber layer. On a diabetic fundoscopic exam, microaneurysms, small bulges in retinal blood vessels that often leak fluid. Blot hemorrhages, dense red, sharply outlined hemorrhages found deeper in retinal layers. Cotton wool spots, yellow, white, fluffy patches seen on the retina. Underlying vascular insufficiency related to diabetic retinopathy. Neovascularization, new fragile arteries in the retina that rupture and bleed. So that's the first half. There's a lot that goes along with eyes, so I'll do a second video about that as well.